We're about to start something called a research showcase, or if you like, speed dating for researchers or researchers on steroids. We have 5 projects and each subject will take up 8 minutes of time. Our first speakers are Kelly Toole and Dr. Elaine Waddell. Kelly Toole practiced as a criminal defence lawyer before joining the Adelaide Law School. Her research interests cross criminal law and human rights. She is on the management committee of the Law School's Research Unit on Military Law and Ethics. Joining her, the Doctor of Public Health, Dr. Elaine Waddell, has a background in social work and has worked with the Australian veteran community for over 30 years in mental health policy, service delivery and research roles. On the subject of veterans in the criminal justice system, Kelly Toole and Dr. Elaine Waddell.
I'll be presenting on behalf of Kelly and myself, and I'm going to talk about the initial findings from our research with former serving members who are in prison. And sadly, this subpopulation of the ex-service community are unable to access a lot of the current supports that have been and initiatives that have been discussed here yesterday and today. The study came about because of increased reporting in the media, as well as concern by veterans that there was an increase in the number of former serving members ending up in the criminal justice system. Because we have a predominantly state-based approach to criminal justice in Australia, there's no uniform system for collecting data to even work out how many former serving members could be in prison. And to date, there's also a paucity of research and policy initiatives in this area in Australia. While very little has been done in Australia, we were aware of the research being undertaken in the UK and Canada and the USA, of course, which has been doing research for a long time, mainly because of increases in the number of veterans in prison post-deployments to the Middle East. Historically, this number seems to spike after major conflicts, including World War I and World War II. We know that the difficulties facing former serving personnel, such as post-traumatic stress, suicide, homelessness, are all known risk factors for incarceration. Research undertaken overseas highlights shared characteristics in their populations of incarcerated former serving members. They're reported to represent the largest known occupational group in prison, are male, and predominantly incarcerated for violent and sexual crimes. Given this common profile across allied countries, we assumed that the Australian profile could be similar. We wanted to understand which former serving personnel are offending, the nature of offences and how they came to be incarcerated. We aim to explore the factors which propel former serving members of the Australian Armed Forces towards criminality in order to inform service provision and potential strategies to reduce both offending and re-offending. We initially worked with a potential recruitment pool of 70 incarcerated in South Australia, and we based that on some Canadian statistics to work out that number. However, a recent audit by the Department of Corrections in this state has placed the figure close to 90. We interviewed participants face-to-face in prison to collect their accounts of their experiences, explore the issues around social factors in pre-military life, experiences within the military, transition and post-military life, including offences committed, their experiences with the legal system and their perspectives on the reasons that underscore their offending. To date, we have interviewed 11 participants over 20 months. They've been predominantly regular army, all enlisted at a young age. At time of interview, they were aged between 28 and 58 years, most being in their 30s and early 40s. Average length of service was 5 years. And there's a link here to the transition study that Miranda discussed yesterday in terms of the risk factors for those who develop PTSD in transition. 5 participants described being actively deployed, the most recent deployment being to Afghanistan. Offending occurred predominantly after discharge, and crimes included serious assault, including manslaughter, sexual crimes including intimate partner or domestic violence. We've organised initial themes, key themes into a flowchart They're based on initial analysis, but we are seeing some patterns. Childhood abuse and rejection was a strong theme, with nearly all describing dysfunctional family backgrounds and particularly difficult and/or abusive relationships with father figures. However, unlike a common perspective in criminal justice theory that criminal behaviour starts in the early teens with abused children, only a couple described pre-military juvenile offending, and these were both reservists. A common theme was joining the military to seek what was missing in their lives: family, structure, discipline, purpose, and self-respect and respect from others. The majority described their military experience as positive, with several having regrets about leaving, and leaving the military to be with an intimate partner, which then didn't work out, was a common sub-theme. Discharge and transition represented a loss and amplified childhood issues, the need for purpose, structure, and social connections. Military training had taught ways of thinking and behaving, which added to the struggle to adapt to civilian life. We heard stories where participants had made poor decisions about social connections, got in with the wrong crowd, etc., and on the pathway to offending. Some descriptions also revealed the use of responses learned through military training in the offending behaviour. All participants revealed mental health issues, particularly PTS, with traumatic exposures and experiences occurring pre, during, and after military service. Several had clearly experienced considerable childhood trauma, but had not received any therapeutic interventions prior to enlisting. All deployed participants described having PTS as a result of service, and the nature of the offence and experiences while in prison were also revealed as traumatic in some cases. Anger and alcohol featured heavily in offending, and 2 participants were serving at the time of offending. Both of these had committed first offences and were heavily under the influence of alcohol at the time. The specialised counselling services available through the Department of Veterans Affairs to all who have served in the military are not available to those ex-serving members when they're in prison. Most describe treatment in prison as non-existent. These former serving members, many of whom would be classified as veterans, have served and have unique experiences that military service brings, yet are denied specialised therapeutic, medical and other services while they're in prison, and we certainly recommend that DVA address this gap. The majority of participants describe self-managing, such as constantly working or putting energy into physical fitness. And in conclusion, I'd just like to say in South Australia there's been a move to develop peer support for veterans in prison, and this has been initiated and developed by the veterans themselves, particularly a prison officer who is a veteran. And the aim is to better meet the needs of former members in prison by giving them back a sense of shared community, identity and respect, and by preventing reoffending by linking in with the veteran community on release. Our study is still ongoing, but we intend to make recommendations in areas including transition, better recognition of the effects of military service in the court system, legal training, the need for access to therapy in prison, and support for veteran-specific liaison services. Thank you.